centers we have prepared, for critical cases, for instance, in Nigeria now?
Now, for critical cases, generally speaking, not just for coronavirus, every state capital has a federal teaching center that has an ICU equipped to handle critical ill cases in peace times. I must add that caveat, in peace times. Now, what happened in Europe, North America, and Asia is a wartime scenario. There is no country in the world, none, that's prepared or equipped to handle this kind of pandemic. No country in the world. And Africa is by far no exception. We don't even have, we have a suboptimal functioning health system. Must be true about it. Different qualities or different levels at different parts of the country, different levels at different parts of the continent, yes. But generally, summatively, we have a suboptimal health system in Africa. We don't have the capacity to handle even the illnesses ill, the common. There are many persons that you manage in the ICU that we don't manage in the ICU, like tetanus patients. The textbook says manage in the ICU, but we don't. And we manage them successfully outside the ICU because we don't have this equipment. Now, even if we were to purchase ventilators massively, for some miraculous reason, we're able to get ventilators. For every person who's ventilated, somebody has to intubate. And not every doctor is trained to intubate. There are few of us. I mean, all answers are trained to intubate. Some persons who work in emergency like myself are trained to intubate. But not every person. So you cannot, even in the next 10 years, begin to create, not even 20 years, create enough persons, produce enough doctors and persons who are skilled enough in intubation to the point that we say, we are ready. I don't think any country can do that. So if to answer that question, we're not ready. But to answer the question, we can provide critical support for the critical ill. In Nigeria, every state capital has a federal center, either a federal teaching hospital or a federal medical center that has an ICU. And many states actually have specialist hospitals that do have specialists that can handle critical illness. But as far as this particular pandemic is concerned, contextually, we're not ready in Africa. We will not be ready in the next 2 decades. That's the reality. Then that's the bad side of it. The good side of it is probably the diseases are where they were not ready. So for some reason, it's still, I talked to top-notch specialists across the world, who my friends, and some of them are nationals of other countries, and they're like, we wish we're in Africa right now. Because right now, we've had under 100 deaths. Let's assume that we are not testing right. And that's true. We're not doing mass testing, and I would not advocate we do mass testing. It would be a mistake if any country in Africa were to advocate mass testing. We should do more testing.
Why do you think it's like that? We shouldn't have mass
testing?
Yes,
mass testing has a problem. Now, you follow the epidemiological data. What Europe, North America, and Asia should have done is follow the WHO guideline. Test, test, test. When you test massively, you rapidly deploy kits, you can easily identify those who are positive and isolate them on time. Then quarantine their primary contact, those who came in contact with them. That's how you spread or halt the spread of the disease. That's the golden rule. However, for countries where you just do not see that epidemiological data going that way, or historically, like as being Africa, we've never seen flu-like viruses spread so rapidly. What you should do for every highly infectious contagion is have just a few centers they can test, because an outbreak can occur from a lab. I say this often. People say, why? We should have test kits in every hospital. I say, no. There's a reason why ISTH era and a few places were always designated as test centers for these deadly diseases like Ebola, like Lassa fever, dengue fever, yellow fever, and now coronavirus. You need fewer centers because we in the hospital, we in the labs can be a source of infection. So when you have fewer centers that can do this test, you look even for treatment. That's why I say when a person is infected, they send to IDH, or Yaba Lagos, or to Enugu, or now UTH, and because of the fear that could go widespread, every state capital is building its own. But ordinarily, in peacetime, you should have just a few. So you localize the infection if there is at all. That's why I call the biosafety level 4 labs. They handle this kind of disease-causing germs that are classified as either class A or class B bioterrorism weapons. There is viruses that can be used for, or pathogens that can be used for weaponization. So you limit the testing. But now, because of the fear that could go wide, so you now have different states, hospitals, federal hospitals across the country looking for rapid test kits. But again, I still advise that if you begin to massively test, and many persons turn out positive, we do not have the capacity politically to handle the mass hysteria that can come out from that. So I would advocate from the health sector, and some other professionals will also disagree with me, but I would advocate that we just limit testing to those who meet the criteria. That is, those who have a cluster of symptoms and have either a travel history or a contact with somebody who traveled recently in the past 3 weeks to any of these affected countries, or somebody who is just returned and needs to be tested so that his or family can know that he or she is safe, and if he needs to go into isolation or quarantine as soon as possible. That's why I would, okay, let's limit our test kit to those persons. Either you're sick or you just returned. That's really a simple criteria. For the rest persons, insofar as you're not presenting with crazy symptoms or requiring hospitalization, let's just do what the government says. Stay at home, practice hand hygiene, social distancing. I believe this 4 weeks since our first incident, we're still not at the apocalyptic stage.